Joe Medicare here with Medicare Savers Network. Hi, I'm Joe Pearson, and I help people sort out their Medicare options. My service is no cost to you, and I don't work for any particular insurance company. Instead, I work for you, the consumer. And today, I'm going to give you a Medicare overview. We'll go over the different components of Medicare: Medicare Part A, Medicare Part B, Medicare Part C, also known as Medicare Advantage plans, Medicare Supplement plans, also known as Medigap plans, the prescription drug plan, also known as Medicare Part D. Once you understand these components, you'll know your options and be able to make a better choice when it comes to your selections. But first, let's start with some basic terms that you're going to hear a lot: deductible, copay, coinsurance, and premium. Okay, let's break these down. First, the deductible is the amount of medical expenses that you will pay each year before your insurance benefits kick in fully. A copayment, is otherwise known as copay, is a fixed amount that you pay when you go to a medical provider upon each visit. For example, the doctor's office visit could be a $5, $10, $15, $20 copayment. And then there's the coinsurance, which is another term used when you go to the doctor and you pay for your visit. You're paying a percentage instead of a fixed amount. Copay is a fixed amount. Coinsurance is a percentage of the medical cost. So for example, if Medicare pays 80% of the medical cost, you would be paying 20% coinsurance of the medical cost. Then there's the premium. Premium is your fixed monthly fee that you pay for your insurance plan. Okay, now we're ready to look at different components of Medicare. So we have Medicare Part A. Medicare Part A is your hospital coverage. It's the portion of your health insurance that covers you when you're an inpatient in the hospital, a nursing facility, or hospice care. If you or your spouse have been paying the Medicare tax through your employment for at least 10 years, then there'll be no premium for your Medicare Part A. They figure you paid into it already. If you don't meet this 10-year requirement, however, you can still get Medicare Part A. However, there will be a monthly premium. So moving on to Medicare Part B. Medicare Part B is your outpatient and physician services insurance. It's the insurance you use when you see a doctor, have a lab test, wellness services. Medicare Part B does have a monthly premium. And with a few exceptions, everyone pays this monthly premium. Now, together with Medicare Part A, in Medicare Part B, this is called Original Medicare, or some people will call it Traditional Medicare. This is represented by your red, white, and blue Medicare insurance card. Now here's the good news. With your original red, white, and blue Medicare card, you go to any doctor, any hospital, anywhere in the country, as long as they accept Medicare, and you don't have to ask permission to see a specialist. In short, you and your doctor have control over your health care. So this brings me to your first option. You can simply stay with Original Medicare if you don't mind paying their deductibles and 20% coinsurance. With Original Medicare, you also need to enroll in a prescription drug plan if you want to avoid penalties. Medicare will be your primary insurance carrier, and you'll present your red, white, and blue Medicare card for services at the doctor or medical provider's hospital. If you choose this option, Be aware that with Medicare Part A and Part B, there is no cap on your medical expenses. In any given year, if your medical bills are catastrophic, then you'll be responsible for paying the 20% of your medical bills. So that could be really quite significant. However, there is a way to reduce this risk. Introducing our next component of Medicare, which brings me to Medicare Part C, otherwise known as Medicare Advantage plans. These are sort of like group style plans that are administered by private insurance companies that Medicare has a contract with, and Medicare also pays the premium for the most part on your behalf. The most common types of Medicare Advantage plans are HMOs, which are health maintenance organization plans, and PPOs, which are preferred provider organization plans. And we get into that in a separate video in our YouTube channel. However, these plans are required by law to be equivalent to Medicare Part A and Part B. Medicare Advantage plans do replace original Medicare Part A and Part B, and they sort of group these benefits into that one Medicare Advantage plan. And like I said, we'll discuss the pros and cons of HMOs and PPOs in a separate video. Now, this brings me to your second option. You can trade in your Medicare Part A and Part B for one of these Medicare Advantage plans. Your Advantage plan becomes your primary insurance. You'll present their card when you go to the doctor, and you will call them if you have questions about your coverage. The biggest benefit of Medicare Advantage plans is that they do have that maximum out-of-pocket limit protection. So even if you have a medically catastrophic year, it doesn't need to be financially catastrophic. Another significant benefit is that they have little or no monthly premium. Remember, the federal government pays the premium for the most part on the Medicare Advantage plans. You're only responsible to pay your Medicare Part B premium. And the Medicare Advantage plans, they do also include a bundled prescription plan. Now, there are a lot of advantages to these plans. So how can the federal government afford to do this? You're still going to be paying for your Medicare Part B premium. And like I said, Medicare will then subsidize the private insurance companies who are managing your care. So that shift in management so that Medicare does not have to manage your care and the private insurance company managing your care now, that's a big management shift for Medicare so that they're not having to worry so much about every single Medicare beneficiary. They're shifting that management to the Advantage provider. That's how they can sort of manage that cost. In addition, these companies, they do manage their costs by creating a local network of doctors and medical providers. If you want the lowest costs, you do need to see medical providers within their network. You can, however, in some cases, see a doctor outside of the network, but it will cost you more, sometimes a lot more. The downside is that with Medicare Advantage plans, you sacrifice the control you had with original Medicare in that choice of doctors. So there is a third option. Yes, you can select a Medicare supplement plan, also known as Medigap plan. With this option, keeps things real simple. You keep original Medicare Part A and B, and additionally enroll into a Medicare supplement plan, otherwise known as Medigap plan. These plans are offered by private insurance companies and are designed to cover the financial gap between what original Medicare covers and what is still owed to the medical provider. These companies contract with Medicare to pay whatever Medicare instructs them to pay. Medicare will be your primary provider and Medigap will be your secondary provider. That means that when you go to the doctor, you only have to present your red, white, and blue Medicare card. The rest is taken care of by Medicare. A significant benefit of a Medicare supplement plan is that you have the same control that you had with original Medicare. You see any doctor, you go to any hospital anywhere in the country who accepts Medicare patients. So let's say you're a snowbird who lives in the Northeast in the warmer months and in Florida during the winter. This is a great option for you. The Medigap plans also have a maximum out of pocket so that your financial risk is capped on an annual basis. So with a Medigap plan, you're paying a monthly premium, which in turn acts as your maximum out of pocket. So your maximum out of pocket is what you pay only in monthly premium because all of your medical bills are covered between Medicare and the gap insurance covering the 20%. So your maximum out of pocket is truly what you're only paying in monthly premium to the gap insurance company. Although many different insurance companies provide these benefits, each with their own price structure, each plan with the same letter is identical as specified in Social Security law. So a plan G, for example, from one company might have a higher premium than another company. However, the benefits are exactly the same. Now, with a Medigap or Medicare supplement plan, you'll also need to add a prescription drug plan. Medicare requires that you have a creditable prescription drug plan in order to avoid the penalty that will be added to your Medicare Part B premium on a monthly basis. So very important, you'll want to make sure that we talk about Medicare Part D, the prescription plan, in order to avoid any of those ongoing future penalties that stick with you for the life of Medicare. So we want to make sure together we take care of that Part D component. So these are the basic components of Medicare and the options available to you. Medicare is, like they say, very confusing. I'm here to help eliminate the confusion and sort out your options, help you shop independently for the plan that's right for you. And remember, there's no financial advantage for you to go this alone. I'm an independent licensed broker who's here to serve you at absolutely no cost. Together, we'll shop for the most suitable option for you, and I'll do a thorough annual review to make sure you continue to get the best possible coverage at the lowest possible price. So let's get to work. Email me, joe@joemedicare.com, or better yet, call me directly on my cell phone, 727-967-8355. I'm also text friendly. Also, you can view more videos at my website, joemedicare.com. And I hope you'll subscribe to my YouTube channel. And if you found value in this video, go ahead and shoot me a big thumbs up. And thank you so much for your time, and have a great day.